Rob Butler.
It is a pleasure to serve under your chairmanship. I'd like to congratulate the Honourable Member for South West Bedfordshire for securing this incredibly important debate, as we've already heard this morning, because this debate brings together two of the biggest complaints that I receive in my constituency: housing development and GP services. The town of Aylesbury has been expanding for more than 50 years. Indeed, the area of Bedgrove, where my parents had their first home together and where they took me as their newborn son, more than 50 years ago, was built on the site of a farm, and many more farms and green spaces have been subsumed by housing developments in the ensuing half-century. Walton Court in the 1970s, Quarrendon and Watermead in the 1980s, Fairford Leys in the 1990s and early 2000s. All have attracted many more people to make their homes in the proud county town of Buckinghamshire. But with each new development, new pressures have been placed on existing communities and the infrastructure that serves them. And key amongst those services is the provision of healthcare, and especially GP surgeries. Mr Dowd, I want to be very clear that neither I nor my constituents are opposed to development. We recognise that the next generation needs somewhere to live, and Aylesbury is a very fine place to choose. But since 2000, more than 16,000 homes have been added to the town. The newly approved local plan will add that same number again. The people who come to live in those new homes need excellent local services. They need road and rail connections like the Aylesbury Link Road and the Aylesbury Spur. They need schools that have enough spaces for all the children living locally. And crucially, they need sufficient healthcare provision, particularly at primary level. Yet already, GP surgeries in my constituency are at breaking point. In common with many other honourable members here this morning, one of the most familiar refrains I hear from residents is that they simply can't get an appointment to see their doctor. In recent months, I visited several GP surgeries, not only to thank the hard-working doctors, nurses and, crucially, receptionists for their incredible work during the pandemic, but also to hear firsthand about the challenges that they're experiencing. And top of the list of their challenges is that there is simply not enough capacity to deal with all the patients who need their care. Meadowcroft surgery is a very good example of the pressures that population growth can have on towns like Aylesbury. The surgery started life in 1964 to serve what was then the new Quarrendon estate. It moved to a new site at Jackson Road in 1992 with 8,000 patients on the list. Today, that list stands at more than 16,000. It'll grow to more than 26,000 when the surgery moves to another new site in Paradise Orchard later this year following a merger. For more than a decade, residents in the south of Aylesbury, in Stoke Mandeville and in Western Turville have been opposed to a new development on a greenfield site called Hampden Fields. The Hampden Fields Action Group are extremely concerned that that development will have inadequate provision of healthcare. Their fears are completely understandable, given that another area, Kingsbrook, is yet to have a new surgery 10 years after its construction. Mr Dowd, it is just plain common sense that new housing developments need to include healthcare provision. GP surgeries, with all that they now include, such as paramedics, pharmacists and, of course, nurses, are absolutely critical to that provision. We must ensure that buildings for these facilities are core to the design and planning of large-scale new housing developments. And we must also remember that we don't just need the premises, we need the people. So we need to ensure we have enough young people training to join the health service across the full range of its professions, with courses such as those at Bucks University, Bucks College and Bucks UTC, all providing that critical first step. We must consider retention as well as recruitment, so that people living in those housing developments will still have excellent healthcare provision in 10, 20 and 30 years' time. And we mustn't forget that primary healthcare can result in referral to secondary healthcare. GPs send some of their patients to hospital. That must not be neglected either when we consider housing development on a scale such as we are seeing in Aylesbury. And all of that cannot be left to a random soup of acronyms, Section 106, SIL, HIF, to make the necessary provision. What we need is a strategic, considered plan that can be delivered fairly and transparently. And within that plan, we probably need to consider novel ways of financing infrastructure so we get it at that much earlier stage, before all the houses are sold and the developers are prepared to pay. Mr Dowd, today's debate is an important and a welcome opportunity to highlight how crucial healthcare is to the British people as we tackle the burgeoning demand for new homes. I hope that the Minister's response will serve to reassure existing and future residents of Aylesbury that the Government understands the challenge and is set to meet it head-on.